Just a second.
Yeah, ma'am. ORDI.
Sure. A very warm welcome to all of you, the patrons of ORDI and Rare Diseases in India. And thank you for joining us today for another session of ORDI Rare Info Series. My name is Krishnendu Menon. I'm currently a business development manager with Olink Proteomics at Thermo, but originally I'm a genetic counselor who has spent many years with many of our rare patients who require the exact same quality of life that we have for ourselves. And hence today's discussion is our focuses on a very important topic that is often overlooked but is incredibly important. We always talk about the medical aspects of the rare disorders, but what takes equal or even more precedence is the non-medical aspects. So today's discussion is regarding the non-medical aspects of osteogenesis imperfecta care and the unique role that doctors play beyond the diagnosis, surgery, and medication. This is a conversation I think that is close to all our hearts, close to the hearts of the clinicians, the counselors, and the caregivers. Because while the clinical care is essential, living with OI also involves navigating the emotional well being, the education, family dynamics, rehabilitation, social inclusion, and long term quality of life. Physicians often become the trusted advisors here, advocates and partners throughout this journey, making their contribution far more than just prescribing of medicine. So we are hoping that today's conversation provides meaningful aspects for the patients, the caregivers, the healthcare professionals, and everyone who is interested in improving holistic care for the individual living with OI. So now it is my privilege to introduce our distinguished speaker. We are honored to have Dr. Prashanth Inna with us today. Dr. Prashanth is a consultant in Paediatric Orthopaedic Surgery at Rangarore Memorial Hospital and Bengaluru Manipal hospitals. He has extensive experience in managing complex pediatric orthopedic conditions, including OI, and has worked closely with children and families throughout their treatment journeys. He has completed his education from his MBBS from Bangalore Medical College, Karnataka, and his orthopedics from the renowned AIMS Delhi. He is a DNB orthosurgeon affiliated with the National Board of Exams. And beyond providing expert medical care, Dr. Prashanth has always consistently emphasized the importance of patient education, multidisciplinary collaboration, and empowering families to actively participate in the long-term care. We are very delighted to have him share his experience and perspective with us today. Dr. Prashanth, thank you for taking the time to join us. The virtual stage is all yours, sir.
Thanks for a good introduction. So I'll start sharing my screen. So can you see me now? Can you see the screen?
Yes, we can, please.
Yeah. So and you can hear me well, I believe. Yeah. So am I audible?
Yes, sir, you are.
Yeah, thank you. So good evening, friends. Today I'll be talking on how a doctor can contribute to non-medical aspects of an OI care of a person with OI. So as doctors, we are always expected, to give our expert opinion on how to diagnose problems, how to treat them, and all those issues. I thought, how can a doctor help OI patients in ways other than prescribing medicines or doing surgeries? Now, always I have been accustomed to talking on these things only, what treatment to give and how to operate and how excellent results to be given. But how can I contribute to a better patient, to a better life of a patient, not by practicing medicine? So it was something that was new topic. I have tried something different. Let me know at the end whether you liked it or you didn't like it or what you felt about it. So basically, I think the significant part of this talk will be on leverage. So what is leverage? How can a person with a decent standing in the society use his standing for the betterment of the people who come in contact with him? And for a doctor, the people who come in contact with him, mainly for whose benefit he works, is the patient population. So the issue is two-way. How can I help the patient and how can a patient take my help when required? So not in a medical way. So that's what. How can a patient or a patient benefit organization utilize me as a doctor? So this was a different thought. Let me see whether it resonates with your opinions also. So a doctor can help a patient at many levels. So I'm talking of entirely non-medical things. So at a personal level, the main headings under which I'll be talking is number one, arrange financial help. Number two, help in availing the government schemes. Number three, influence jobs. So in influencing jobs, a doctor can help a patient in getting a job or in managing the workplace if the patient is already employed. And lastly and most important, just be a friend, not just a doctor. At a community level, a doctor can create and manage patient benefit organizations. I'll be talking in detail on these various headings again. You can help these organizations, not just set up the organizations, help them the way, I'm managing, you expected me to do right now. We can interact with the government agencies, get laws and regulations made, and we can use our leverage to influence decisions. I think I'll be using this word leverage repeatedly. At the national or the international level, a doctor can communicate or coordinate with various agencies, again at an individual level, individually or through the organizations which he has set up or with which he works very closely. He can contribute to research work. Of course, this domain comes under the medical work, but when I was talking about work other than a direct interaction with the patient and a one-to-one treatment for the patient, the research work does not fit into that domain. So research work is not a one-to-one interaction, it's interaction as a whole. So the research work, in the research work, a doctor can coordinate with other health institutions. He can do the publications of his work. I know these are sort of medical, but not individual or one-to-one medical. These are a medical help offered on a larger level. So I'll be discussing each thing. So on the personal front, we can arrange finances. How do we do that? First and foremost was the social welfare department of hospitals. So when I entered into practice in 2011, we had a very good social welfare department and they used to come and interact with us almost frequently, almost weekly, twice to thrice. I would meet a medical social worker. In most of the hospitals, unfortunately, even in charitable hospitals, the social welfare department has vanished. Needless to say, in most of the corporate hospitals, it's almost non-existent. A doctor can help a patient by arranging the hospital funds. So what are these hospital funds? The hospital, most of the hospitals do keep a portion of their funds for treatment of patients who deserve treatment and who cannot afford it or who are likely to need repeated procedures because of which they cannot afford the repeated interventions. So a doctor can use his know-how to get the funds from the hospital fund. So that's about the second point. Third thing is through patients. It's very common that when a patient, if he is satisfied with my treatment or with any doctor's treatment, need not just be my treatment, when patients are satisfied with the treatment that we have given and when they can afford, it is very common for them to offer help, mainly financial help, for the treatment of other patients who deserve the treatments. And you would also been, patients would have commonly experienced that when they are unable to afford particular treatment or particular, say, an orthopedic aid, the doctor gets the patient in touch with other people who are ready to help them. Now, how does a doctor come particularly in this? Somewhere, I think, patients trust doctors more than the general population. And probably there is an element of nobility involved in medicine. So doctors are considered a bit more noble than the other people. And so when they have to make donations, they want to make sure that the funds or the money reaches at a correct place. And when they want to do it, they want a person whom they know will utilize the fund in a correct way. And I think that is where most of my patients, most of any doctor's patients have come in. They are reasonably sure after their interaction with us that this person is likely to utilize the money that I want to give in a good way. Now, we can also do this through the NGOs and charitable trusts. So it's like the patient care organizations. They have certain, associations with organizations which collect funds and give to the needy people. I also had come in touch with an organization called ABMSS, Akhil Bharatiya, I think, I don't remember the full form. They had funds from European countries and they would have preferred to utilize it on the treatment of patients when particular doctors recommend it. So I think patients can directly approach these charitable trusts, but they have a sense of, trust deficit when it comes to giving funds. But if that recommendation comes through a doctor, I think the trust is slightly more. In a similar note on the third point, through patients, at a time, say maybe around 5 to 8 years back, in the treatment of developmental dysplasia of hip, we use a particular harness called Paulik harness. I had a set of around 15 Paulik harness in my car. And almost all the Paulik harnesses were new or given by patients. All of them new were donated by patients. And I was fortunate to have around 15 patients donate Paulik harness worth 5 to 6,000 each. And I had utilized it in many patients. So this is how patients want their funds to be utilized through the doctors, and the doctor can channelize that fund to the treatment of patients with rare diseases or with any disease. How else can a doctor arrange funds? So suppose a patient wants funding. So the common thing that we know now is called crowdfunding. So the common apps, the common websites are Keto or Milap. So what do we do here? The patients put a story about their original condition with proof from various hospitals or doctors that this is the problem and this is the treatment and this is the amount that is required. What I have heard from patients and even from these website coordinators is that if a doctor per se puts these petitions, the response is higher. Of course, there is a little bit of trust deficit in the general population right now. So even when people do ask for money, we doubt whether they are truly in need or whether they are just thugging us. Doctors can also thug people. I'm not denying that. But probably people trust more if a doctor himself has put up an application for a patient whom he knows. So again, I think I'm just giving a slight credit to the doctor, but maybe I think that is what even the coordinators of those websites told me. Second thing is charitable auctions. So I had come across certain people who said they can auction a part of their collections and the money can be utilized for the treatment of patients. And again, routed through the doctors and routed through people like me. Third one is CSR quotient of business firms. Now we know that almost all the big business firms have something called corporate social responsibility, or in short, CSR quotients. And they want to utilize those funds in certain areas, and they're very keen. Most of these people are very keen to utilize them in the medical treatment. Again, I have people in contact with the bigger companies, and they have told that when a doctor approaches for getting the funds from a bigger company, the possibility of a CSR fund being allotted is slightly higher than when others approach. So again, I think it's more to do with the trust that doctors have with their patients or with the population in general. And these are the non-medical ways a doctor can help. We utilize maybe the goodwill that we have developed among people to get funds and utilize them in a correct manner. And these funds can be got from the CSR quotient of big business firms. The last one is digital health lending platforms or medical loan options. So even when these are dangerous options because they have very high rate of interest, but if the amount required is maybe less, or if it is likely to be sorted out fast, then these are one of the ways where a doctor can help. And finally, we all know doctors do personally help with finances for the treatment of patients that they treat. So these are the various ways in which a doctor can arrange funds on a personal level. On a personal level, talk to people, talk to the business firms, talk to others, talk to your patients, and get funds for the treatment of people. The second thing is we can direct the people towards schemes. So basically, the ignorance of, I feel, sometimes doctors is as good as the ignorance of the general population regarding the various schemes. When we had these social welfare departments, the access to these schemes was very nice. Now with the death of the social welfare departments, the access is not that great. But yet, doctors do keep in touch with many boards, and a doctor can direct a patient to get funds for his treatment from government schemes or private charitable houses. There are many community-based private charitable houses. Commonly, you would have heard about Jain Charitable Trust, the Marwadi Charitable Trust. Those trusts are community-based and they do give money for various purposes. Now, these schemes can give money for education or they can give for treatment, both. We also have local MLA and MP funds. MLA is Member of Legislative Assembly and MP are the parliamentarians. These funds, these people also have funds which they allocate to the treatment of patients, and letters of recommendation from doctors, particularly if the doctors are famous and reasonably known to these MLAs, is more likely to fetch funds. And how do I know? Again, personal experience. If somehow I had come in contact with the MLA or MLA's relation and I give a letter to that particular MLA, I have had personal experience where the funds come very fast. And yes, we do feel happy when these things happen based on being a doctor's special recommendation. The third thing is letters explaining or convincing the need for funds. This we commonly do. So whenever a patient needs a treatment, we do give letters saying that this is the condition, this is the treatment, and this is how much it's going to cost. This, I think, most of the people, most of the patients would have gotten these sort of letters from doctors. And lastly, it is arrange point of contact. What happens is when you know that there are various schemes, but the patient does not know whom to approach. It is not very easy always to find it out online. And always in hospitals, if you come and say, we need to arrange funds, whom should we contact? You don't know where to contact, which is the point of contact for the various schemes. Basically for government schemes or private schemes or wherever. Where should the patient go and get in touch for availing funds from the scheme? So I think a doctor can arrange that point of contact based on his know-how. Then influence in the job scenario. So there are two things that a doctor can do. Number one is getting a job. And number two, if person is in a job and has some special requirements, the doctor can influence arranging the workplace, making the workplace modifications so that the life of that particular patient as an employee is good. So coming to the first point, getting a job, I had this inherent hesitation to ask a favor, which is common in almost all of the people. We don't like to ask favors, and particularly to ask a favor for someone whom we hardly know or whom we do not know much. Even to ask a favor for people whom we know, suppose if it is my own relative and I'm asking a job for him, that hesitation is there. That I also had. But we sometimes grossly underestimate our power. So once a patient who was wheelchair bound wanted a job, I did ask a particular firm for a job, and within 3 days, the job was arranged. And then I was 7-8 years younger, maybe even more younger. I don't know the exact age. So at that time only, if somehow by God's grace, I could manage to arrange a job in 3 days. I think we sometimes tend to underestimate our power. And after that experience, I have been slightly more open in trying to get jobs for people. So, of course, as a patient, if you want to get a job, in addition to Naukri, probably you can remember your doctor also and go and ask him, Doctor, can you help me get a job? So, for a patient, you can keep that in mind. Then the second thing that a doctor can help with is the arranging workplace modifications. Particularly the first point will be ergonomic or proper seating arrangements. We know that for patients with osteogenesis imperfecta or for other patients, they have different deformities or changes in the shapes of their body. And so the particular chair or the desk might have to be changed. Now the common desk is around 3 feet in height, but if the overall height of the patient is say 4 feet, a 3 feet height desk will be too high. Then you have to change the desk, and a doctor can come in giving recommendations as to how should be the proper seating arrangement. Second thing is office positioning for better interaction. This was a wonderful concept which when one of my patients told, I found it so easy, so nice of that particular office. They had 2 rows of people sitting. They had arranged the 2 rows in a circle. And in the center of the circle, people with disability would sit. And whenever the people would get up and go for a coffee or get up and go out of the hospital, the employees were encouraged to touch the person in the center and talk to them. Touch and talk. And I found it very nice because the person who worked in that office, sitting in the center with all the people coming and talking to him, he made, that person felt involved and a part of the team, even though he was special. He was not as able as the other people, but still he was made to feel very nice. And that sort of office positioning, I think a doctor can help get for the various patients. And third thing is getting ramps and wheelchair accessibility. Yes, there have been instances where I have talked to the boss of the place where my patients work in a nice way. And the people have also been nice and they have arranged these particular things for their employees. And when it happens, you feel happy that you have helped a patient, not just in a medical way, in another way also. This probably comes in the feature of leverage. How can a patient use a doctor for arranging these things? So how does a doctor get the workplace changes done? By giving a physical capacity estimate. I can tell what are the things that a particular person can do or cannot do. And so the office can make suitable adjustments for that. Skill validation. I can give a certificate telling that this particular person can do these jobs or may not also. Regarding this, I remember an instance where once I was getting a job for a particular person, that particular person specifically told me that don't tell that I am specially abled. See whether you can get a job without telling that I am specially abled. So I was just validating the skill of the person. I was not, sort of trying to gain sympathy because he is special. So I was just trying to say that this guy can do everything. So just give him a job without telling that this guy is wheelchair bound or anything. Third thing is setting duty limits. Of course, we know that people want to be completely involved in the job, but sometimes your physical limitations may not allow you to work say 10, 12 hours or 14 hours in a day. In such situations, the doctors can pitch in and tell that no, this particular person cannot work continuously for so many hours. So that's about duty limit setting. And yes, we can give a letter, we can talk to the employer, or probably we can work at various levels to get these duty limits adjusted. Shift adjustments again. Suppose if a person say is not independently mobile, say he's wheelchair bound or he's something of that sort, you cannot have shifts wherein he comes out at 6 a.m. in the morning or 12 in the midnight. It's very difficult to arrange transportation for such people. So in such situations also, doctors can help and tell them that no, we need to be more considerate to these people. Next, coming to the community level. How can a doctor help a community level thing? The organizers, if I have to stop, please let me know. Yeah. So at the community level, you can set up a patient benefit organization, just like I had set up one. I was one of the founding members of Indian Osteogenesis Imperfecta Foundation, and then slowly I moved out. Or you can help them set up these organizations. The other thing is getting good directors on board. Whenever you set up, say, a particular organization and that organization goes to somewhere and says, we do this work, please arrange some funds for us or please help with certain things. If your board of directors are good, then probably that particular NGO is more likely to get funds or arrange help for the patients. So getting good directors on board, doctors can probably help. We do have certain know-hows, and based on our know-hows, you might get good people to be on the board of these NGOs. That helps in the fund procurement as well as build the credibility. So sometimes, suppose there is an organization which is, say, promoted by Sachin Tendulkar for the benefit of cricket players. People are more likely to trust it rather than someone else. So that way, if the director is someone credible, then the overall organization gets more credibility. How can a doctor influence government regulations? See, these are very important because for people with special needs, the funds have to come from the government agencies also. And when the funds have to come, how can a doctor influence these funding? So a doctor can help in system-wide health service planning, in resource allocation. So suppose the government has decided that it wants to give 1,000 crores to the treatment of people. Now, out of those 1,000 crores, how many crores will be given to rare diseases? How many crores will be given to hypertension, diabetes? How many to trauma, injury? How many to heart diseases? In this sort of planning, probably a doctor can influence the government and make sure that certain resources are allocated well. Priority setting, that's what. Where should the money go? The priority setting can also be done for, the doctor can contribute to it. Then the doctor can make the healthcare system more responsive to patient and population needs, because you can influence the decision makers that this is the need of the population and make it more democratic. What do I mean by this? Suppose if someone has more leverage, they are more likely to get it. But if the disease load is more in a particular variety, the funds has to go more there, not exactly where someone has more influence. So I think in those rational decision making, a doctor can influence these decisions, and so you can make sure that the funds are distributed in a good way in the areas where funds need to go. I'm talking of diseases. Which diseases, how many funds to go, you can make it more democratic. This can be done at different levels, at individual level, district level, state level, or national level. How can a doctor influence laws and regulations of a bigger level? Doctor can be a part of the official advisory committee which form the laws, of course. You can give clear suggestions whenever they ask for opinions. You can influence the committee members to work in your favor. This is called leverage. If you know who are all there in the committee, and if I know those committee members, I can use my know-how and influence them to, make these rules and laws. Influence the legislators with inputs. You can influence your MLA and MPs and request them to talk on this. We have done that also. And in US, we have various orthopedic organizations where a portion of the funds legally, let me be very clear, legally is kept separate to influence the legislators, to influence the rule making, to make sure that the legislators make rules in our favor. Some of the organizations set apart a portion of their money to influence the legislators, and this is not illegal. If it happens in US, it can happen anywhere. We can also use our doctors' body's clout to influence. Like we have the Indian Medical Association, IMA. We can use our IMA to influence the government laws and regulations making. And we can use the public servants among doctors for the purpose. There are many doctors who became IAS, IPS, MLAs. We have many doctor MLAs, we have many doctor ministers. We as doctors can communicate with them and make sure that the rules are made into the benefit of our patients. So that's how we can use those IAS, IPS officers who are also doctors, who know us for the benefit of rule making. How can I influence individually? We can organize. So, just my own effort. See, till now, I was trying to influence the government rule making. How can I individually influence it? A particular doctor can organize campaigns, either online or offline. You can organize rallies on your own. You can use social media, Instagram, Facebook nowadays, and influence the people. You can collaborate with other stakeholders. Suppose if there is a particular disease, who are all the stakeholders involved? The nurses, pharmacists. A doctor can coordinate with those bodies, nursing council, pharmacy council, and then you can influence the decision making with regard to rules and regulations. And this one is very important, educating self and peers about legislative process. This took hell lot of time. Even now, I think I'm so ignorant about the legislative process that I don't know much at all. If I have interest, I try. Still, I can't manage to educate myself about the laws of the land, how they are going to be made. So, imagine some of my colleagues, they're even more ignorant. So, it's a part of my responsibility that I teach my other colleagues also about the various legislative processes so that they can influence the care of the patient. This word I've used many times, leverage. You know, it's something like lobbying, or you can call it polished influence. You're not exactly utilizing money. You're utilizing your goodwill. You're utilizing your good standing in the society, and of course you're using it for a good cause. So after all, it's not bad. So this leverage, even if we use it, is okay. So lastly, how can a doctor influence a patient care in a non-medical way at a national or international level? We can communicate with various agencies like OIFE, the Osteogenesis Imperfecta Federation of Europe, etc. On an individual level, we can contribute to non-medical research. Why always medical research? A doctor can contribute to non-medical research also. You can be the point of contact in India for coordinating the agencies, different agencies that deal with osteogenesis imperfecta. And on a medical level, you can do individual publication of your research. You can collaborate with other health institutions, and you can formulate guidelines for patient care. These are not government guidelines. These are individual body guidelines. Say like we have Indian Orthopaedic Association. IOA can form guidelines on treatment of osteogenesis imperfecta, and you can be one of the people who influences these guidelines. So that's in a way medical help, but not one-to-one medical help. I'm not dealing with the treatment of one patient. I'm dealing with the treatment of so many patients. So this is also sort of non-medical contribution of a doctor to the medical treatment. And last, be a friend. Why should it be that a doctor should always just talk about medicine? Why not he be a support? He can be an accomplice in your journey, not just as a doctor. And he could be a shoulder to cry on. So maybe next time, if you are in a problem and if you want to call a friend, don't hesitate to call your doctor. Thank you. I tried something different this time. Definitely, I didn't talk about any medical treatment. Let me know whether you liked, it helped, or whether it looked very general and unhelpful. I'm open to all comments. Thank you.
Thank you so much, Dr. Prashanth. I think it was one of the most insightful and thought-provoking presentations, and you have highlighted beautifully that caring for a child and their family with OI extends beyond the medical interventions, and that empathy, communication, the financial support, and the multidisciplinary support are equally important components of care. Thanks so much for highlighting that. And now we will move on to the Q&A question. If anyone has questions, please type them into the chat box, or you can use the raise hands. I don't know if the raise hands feature is available, and we can take as many questions as the time permits. I think
Just to add, yes, I did
yeah.
talk about the non-medical aspects, but if people want to ask the medical aspects, I'm open to questioning them, answering them. Yeah, but yeah, I would be happy if the questions are from what I taught. And yes, I would like to know what you thought. as you would have seen, it's the patients, the audience, what they thought about the content of the talk.
So I think as the team is writing the questions and coming up with questions, I had a couple of questions from
Yes,
my
yes.
side, which we can start with. So, Dr. Prashant, I think one of the things that from your experience, what is the one non-medical aspect of OI care that families often underestimate when they first receive the diagnosis and they should be looking at?
I think it's the psychological support.
Yeah.
Psychological support. So it might be coming from not just from the family. Psychological support can come from anywhere. And so I think they would need that support. Someone who they can turn to, not just for money, for the support for being strong, handling the tough situations in life.
I think that is true. Even a couple of patients that we have seen in the past, it is more of not blaming themselves also, right? Sometimes the parents have the feeling, hello, is my
Yeah.
internet stuck? Yeah. So if sometimes as a you have a caregiver guilt that lives on as a parent, which many a times we have seen that also hampers their mental well-being. And so, how important do you think is the mental well-being for a caregiver? Because not just for OI, I'm just broadening the scope of discussion here. Is that any rare disorders? We of course the patient is the first priority, or the affected individual is the first priority, but uh, it is a journey that is lived with the family, and
Yes,
many a
correct.
times the emotional well-being of the family members, especially the parents, are neglected. So how important do
Correct.
you think is that we have such conversations?
That's an extremely excellent question. To be frank, I think there are certain things which are lacking in our curriculum. Now, the common thing that I tell is from morning till evening, doctors interact with public, interact with people, but we don't have any aspect of the course that is dedicated to human interaction.
Yeah.
But that is what we do. From morning till evening, we interact with human beings. But we are not taught how to interact with human beings. We are taught how to learn medicine and give medicine. But that particular aspect is missing. And that particular aspect, I think you learn on the job if you're empathetic.
The empathy is a skill to be practiced.
Yeah, so, so if you are empathetic, you will learn it on the job. And yes, as you say, as caregivers, they feel so stressed. And it's very common for me sometimes to send the patient out, just talk to the caregivers for a few times, and many times they break down. But I think that is required for the benefit of the patient also. Because if
Right.
the caregivers are strong, then the patient care will be there. If the caregivers start getting weak, it will be bad to the patient. So this caregiver care to the caregiver is very important. I think a part of the curriculum in MBBS should be about dealing with the psychological aspects.
No, makes sense. I like the line that you use, care to the caregivers. As medical practitioners, it would be great if more and more we talk about this. And on that, there is Suchita Sahukari has raised an hand. Chetna, can you give access to Miss Suchita to ask a question?
Yes, I already informed, but she's telling her question is too lengthy.
Uh,
So she is a OA
oh,
patient. She wants to ask something
okay.
with doctor. Can I promote her to, panelist?
Yeah, yeah.
Yeah.
Please, please, please.
Just a minute. Yeah, Ruchita. Ruchita, are you there?
I think she's muted.
Yes, yes. I'll check, ma'am, in between.
Good morning, sir. I'm Ruchita Saukari. I've
Yeah.
recently completed my post-graduation in English journalism. So I was here participating in a placement drive in Delhi. So it has become very challenging for me to get a job right now because due to the dynamics of the profession that I have chosen, it's the first time that a OI person has chosen the journalism. It is completely out of my passion. Post attending multiple interviews, the only question that they get is like, we have stress. What if you get hired? The problem is, okay, even if I'm giving them an option of remote and other way, I'll be doing remote job but staying at the job location only. They are like not able to open up that much to include me. And I have gained contacts of fellow other students who have pursued journalism while being on wheelchair. They have shared with me a huge biases in the industry, in the media industry, that person with disabilities faces. Like why the voice of disability is not yet reached that industry is that even they have lived something, anything, but they are not open to accept a disabled employee in the media organization. And while attending multiple interviews, I have realized this somewhere. But the biggest challenge is I got to convince my parents, my family, to shift to Delhi to just to participate in the campus placement, which was been very difficult challenge for me, because I come from the background where educating a person with disability is not so encouraged. So my father has given me only 2 months of time. If I didn't get a job, then it will be my fault, he said. But the thing is, it is a challenge that I'm facing. And on the 16th of August, I am leaving Delhi, and I always dreamt of getting independent, and getting a job has become a really big challenge. I don't know how to make this organization understand this, how to make family to understand this, to give me sufficient time. Because from the past 1 year, my mom has been traveling with me, and she is really tired because she has kept her life aside, and from the course to the campus placement. And she is frustrated that I'm getting bored here in room, we don't have anything to do while I'm attending interviews and going to college. So now, but without mom, I can't continue my career. So there are two things. I don't know how to balance them, and how can I solve this problem. I just want to ask, because you said ki you can ask more than medical things. So you also brought this topic of employment challenges that people with disability, I'm sorry, or even OI people faces. So it is very new industry for me. No one has pursued in my family. No one was there in this sector that I am in.
Oh, yeah. This is where I think if the employer is ready to listen and is a bit sympathetic, then a doctor can talk to him, can influence him, and can try and fetch a job which a normal person can get. But here again, it depends. There are multiple things involved in this. The employer should also be ready to bend a little bit and listen to some of the suggestions. So in that, the only way a doctor can help is how he can talk to the particular person, particularly if he knows that particular guy, that will be very good. On a larger scale, such things can be raised in forums, and probably you can, as a doctor, you can talk about these things. And that's how I think in a larger scale, people like you can be helped. But on an individual level, yes, by talking to your employer, we can try and get this sorted. But again, there are variables in this, and the employer has to be slightly more receptive. As far as the frustration faced by your mom, that is what we were discussing just a few minutes back. The caregiver starts getting frustrated, and I think as a doctor, we have to take care of that part also while treating. And in your case, not while treating, the caregiver has to be taken care so that your overall life is kept nice.
Oh, I think that's wonderful. In fact, I think thanks so much, Ruchita, for asking that question. And thanks for, it is really, I maybe using the word inspiring is wrong because you are doing exactly everything that you want to do. So that is great that you are not conforming to what the society is telling you, because as you rightly said, journalism is a passion that you have and you must pursue it. But in this case, if organizations can like ORDI, etc., that has fellow companions in this journey, can also be of use with the support of clinicians like Dr. Prashanth, having a having a larger discussion with the fellow OI companions, etc., will be of use too. But thank you so much for bringing this question up and bringing this question up and hoping that we see you at a news channel front very soon. That would be really amazing. I'm sure the ORDI team and all of us would be really excited uh, to see that. So, Dr. Prashant, one last question, maybe from before the team also say,
Yes, ma'am.
asks you is that what advice would you give to parents, like taking up a leaf of a feather from the hat that Ruchita was mentioning? What advice would you give to parents on encouraging independence while ensuring a child's safety? Because I'm sure the parents, as much as they want to encourage independence, they are also scared for the well-being of their children, right? So how do we balance both of them? Do we have enough infrastructure in India that can ensure safety while pursuing their passion?
I think, the government as a whole has been trying really hard to make people inclusive, to make the job environment, the educational environment inclusive, and to get people with special needs into normal lives. Definitely, the government is helping. The infrastructure may not be as great as in some of the developed countries. I have stayed in Korea, I have stayed in US, I have stayed in UK. I think the infrastructure there is leaps and bounds ahead of us, but we are getting there. We are not that bad. And as far as people trying out is concerned, I think the patients who have come to me would see me as someone who always tells you to keep going ahead, keep trying things. So I treat people with cerebral palsy and they have very poor balance. And the common thing that me and the caregivers tend to ask is the caregivers are very hesitant to make them walk because they will fall. And I keep telling, please let them walk. Let them fall, that's okay. But let them try. So I think as an individual and as a community, we have to encourage them to keep trying more and more. And that only will give them the confidence to try to be normal. Otherwise, if you try to keep them as someone privileged who are not supposed to try things which others try,
Yeah.
then you're not going to let them be a part of the society. So let them try. Yes, they have some issues. They might find it difficult, but the determination and the enthusiasm, I think, will overtake the disability.
Absolutely. I mean, it is the determination that can move mountains.
Yeah, yeah.
So, agreed, Dr. Prashant. Is there any other questions from the participants before we close the session? I think we do have a mixture of some clinicians, fellow clinical geneticists, genetic counselors, and patients and caregivers who have joined today.
That's nice.
Yeah, and I'm sure have been they have very much benefited. Maybe one last question before I conclude from my side is that how has your approach changed to caring the patients of OI? Because where you're coming from, I can hear a lot of empathy, I can hear a lot of support, and uh, lot of passion that I'm sure would have evolved with time. So how has your approach changed over years that we can learn from?
I think now, before assessing the disease, I try to assess the patient. So you have to judge what that patient is and then come to his disease. And so my first questions are not about how long you have pain. My first questions probably start with what is your name, where do you stay, and where are you from? So that also matters. And then comes your disease and your treatment. So the other aspect is also what I'm concentrating.
That is great to hear. Thank you so much, Prashanth, for your for your time and that insightful discussion. So,
Thank you.
as we come to, I think we're running out of time. So, as we come to the end of today's session, I would sincerely like to just thank you, Dr. Prashanth, for sharing your insights and the valuable comments. Today, as we discussed more than just the disease. Today's discussion reminded us that while medicine treats the condition, it is the compassion, holistic care that supports the person and the family, and the doctor's role extends beyond the procedures and prescription, right? It includes listening, educating, encouraging, and advocating. I would also like to thank everyone who has joined us today and participated in the session. We sincerely hope you found it informative and inspiring. On behalf of ORDI and our partners, thank you once again for your time, everyone. We look forward to welcoming you to the next session of the Rare Info series. Thank you, everyone. Have a wonderful evening and stay safe. Thank you.
My pleasure. Welcome. I'll leave this.
Thank you so much.